So today we're really trying to focus in on hip extension and separating the lumbar and pelvic spines and from the hip joint. Okay, so really trying to get good rhythm in the low back all the way down. For a lot of us that get into the anterior pelvic tilt or hyperlordosis of the lumbar spine, the body starts to put a lot of weight onto the back part of the lumbar facet joints. And then that also puts a lot of stress on the anterior part of the hip. So we get a lot of hip impingements because of the orientation in the lumbar and then the pelvis. And so what we want to do, you can see here, we're really trying to stretch the rectus femoris muscle, one of the primary hip flexors. It also crosses the knee joint. So we're using a rubber band right now to kind of pull and activate that muscle. But we really want to kind of come back here. Good, just right there. Flex the tummy, almost like sucking in and flexing the abdominal muscles. So that brings us back into neutral lumbar positioning. And then from there, we're just trying to extend the hip, where we drop the hip forward and really get a nice rotary movement right here. So we're stabilizing the core, and then yes, activating the glute. You feel that? Mm-hmm. Cool. And then we also extended right here and flex the knee. Good. So this is a hard stretch to do, especially if we have tight hip flexors. And for those of us that wake up in the morning and our lumbar spine is like, just feels like it's been cramped all night, that's usually because it's been stuck into that tilt position and it hasn't really gotten a lot of rest. So we can also use the rubber band to kind of pull the muscle and then activate the muscle by giving a light kick. Good, so nice and balanced, under control, and doing a light little kick will turn this into what's called a P&F stretch, where we're stretching the muscle, doing a little activation at the end range, breathing through it, and then relaxing, and we actually get a deeper stretch there. So that's an excellent one. Be sure to be careful with this one while you're starting off, because if you have hip pain and hip trouble, doing this can be difficult. So we really want to isolate the movement first and then go into a deeper stretch.